in my opinion, there are two kinds of policies that are dangerous. The first one are non-transparent policies and insufficient policies to address the situation already at hand. So for an example of these would be, when a government choose to not disclose data that are important for their people to know, thereby creating a false sense of security of the already very bad situation, right? This is also, the situation in which maybe a government, for the fear of social unrest or political stability, choose to do the minimum measures against the virus when they're actually supposed to be implementing stringent measures to save people's lives. Yeah. So, and the second dangerous policy is a policy that missed the point. The policy that pays attention more on the security and political aspect more than healthcare aspect. So included in this kind of policies are those mitigation policies that include, for example, abuse of the citizens or hostility, or those kind of policies that would pave a way for a government to do repression or authoritarian style of governance in the end. So this is also dangerous. So talking about Indonesia, somehow, unfortunately, Indonesia embodies these two kind of concerns for so many people. So there are many people that are now concerned that there has not been a transparent policy. There has not been any transparent policy about the combat, to combat the virus. As also the policies have come quite late. And also that there is really no clarity what is really the battle plan, right? What is the battle plan really? In Indonesia, as you all understand, Indonesia is the biggest country in Southeast Asia, 270 million people. So if Indonesia is very sick, then the region is in trouble also. So the second thing that are concerning, I think, especially for civil society, is this tendency for Indonesia to look at this thing as with a security and political lens, political logic, more than healthcare aspect. So, for example, there was a talk of enacting civil emergency, which would be a contingent strategy in case the current social restriction measures that are now being implemented are deemed ineffective. But before I continue with the Indonesian case, I think it's important to clarify the confusion that some people might have concerning different methods that have been used around the world. Yeah. So I'm not an epidemiologist, but based on what I read so far, there are two main methods that governments around the world have been implementing. The first one is suppression, and the second one is flattening the curve or mitigation. So these two things are two different things. Suppressions are not flattening the curve. Yeah? So suppression is aimed at drastically reducing the number of cases. Yeah, slashing the infection rate daily, and also, reversing the already very, very rapid epidemic growth. The only way to do this is to severely restrict people's mobility by a lockdown, right? So unfortunately, to drastically reduce the infection rate, countries that have already had a lot of cases, thousands of cases, and a lot of numbers of deaths, should do a lockdown, right? But the question is how to do a harsh quarantine that still cares for the rights of the people. That is the concern. So, but what is lockdown itself? What is really a lockdown? There's no specific formula of what is lockdown or quarantine. Yeah, the harshest or the most complete version of a lockdown is what happened in Wuhan, right? Where people are made to stay at home completely for weeks. People are taking temperature 3 times a day, and there are harsh penalties for those who are caught going outside. China is China, so this worked for them, right? So this kind of total lockdown was successful, seemed to be successful in China. Large Southeast Asian countries such as Thailand, Malaysia, and the Philippines, realizing that they're also large geographical size and large population size, also are concerned with, the rapid infection rate. So they have opted for some sort of a lockdown, even though it is not, It is not a total lockdown like in Wuhan. Like I said, it has to pertain to a socioeconomic condition of each countries. So they opted for a partial lockdown. There are different kinds of things that are happening in these three countries, but so far there are aspects that are similar, which is the closure of borders, the harsh restriction of movement domestically, and then a closure of schools and businesses, except for essentials such as supermarkets and markets. So that's the suppression, locking down, quarantine, right? So the second method is flattening the curve. This is different from suppression. Flattening the curve aims to slow the infection rate and keep it at a low point for as long as possible. The assumption is that a lot of people will still get it, but they will not get the virus at the same time. The aim is to not burden hospitals, so that hospitals will not get so many patients at the same time. So the methods used are not locking down, but physical distancing, track and tracing, as well as testing. Which countries have been doing this? The countries that have the capacity to do so, like Singapore. Singapore has the capacity to do meticulous track and tracing of patients and contacts, and also testing. But then last week, because the number of cases spiked, Singapore also introduced a more stringent measure, which has elements of quarantine, such as closing schools and offices and urging people to stay at home, as well as, banning foreigners from coming into the country. So they combine both suppression and flattening the curve. Back to Indonesia. So what about Indonesia? It is unfortunate to say that Indonesia is not there or here, not here or there, So for a long time, Indonesia has been dithering and has been reluctant in introducing stringent measures for fear of unrest and political turmoil. Some leaders in the beginning, I think these are all over the a news report, actually. Some leaders in the beginning of the outbreak in Asia even jokingly said that Indonesians are immune to this. This is absolutely not true. Nobody is immune. So for months, Indonesians were only urged to do physical distancing and washing hands. So very, very minimum. Newspaper reports even mentioned that the government said that a lockdown is not suitable to Indonesian culture and level of discipline. So meanwhile, the number of cases soared to thousands, the number of deaths to hundreds. So at the moment, Indonesia now has 4,241 cases, 373 deaths. So the mortality rate in Indonesia is almost 9%, right? Which is very worrying, the highest in Southeast Asia and one of the highest in the world. As a comparison, Malaysia has 4,683 cases, just slightly more than Indonesia, but only 76 deaths, which means 1.6 mortality rate, very low. Thailand has 2,551 cases and 38 number of deaths, very low, right? So 1.5% mortality rate, very low mortality rate. So, and remember, Malaysia and Thailand, lockdown or partial lockdown, right? So compared to Indonesia, you see how we are very concerned of this biggest country in Southeast Asia. So the Indonesian Doctor Association has reportedly urged the government to do stringent measures of a quarantine or strictly restricting people's mobility for weeks, but it was somehow not paid attention to. There are multiple letters, including a letter from the Association of Internists that urged the government to not experiment with the herd immunity theory, which is completely a totally different discussion altogether, because it's very dangerous. And recently there's a letter from the Association of General Practitioners, again doctors, that cried for the government to do stringent measures and to provide doctors with adequate medical protective gears. So for your information, there are already 30 doctors that lost their lives in Indonesia treating patients since the beginning of March, right? Because they lack protective gears. Hospitals have been relying on the kindness of citizens' initiatives that provide them with masks and protective gears out of their own pockets. And also for your information, Indonesia only has 300,000 hospital beds. This translates to 1 bed per 1,000 people, right? So if we assume that 10% of Indonesian population will get the virus, the number of beds are already not enough to accommodate these patients. This is how worrying this situation at the moment is. So with this, these weeks that have been push and pull between the regional governments and the central government. So only very recently, the government,
you have 2 minutes.
Central government, two minutes. Oh, okay, yeah. The government introduced a minimum restriction measures called the large-scale social restriction, which includes the closure of schools and offices, limiting the number of passengers and operation hours of public transport, and banning gatherings, including religious and sport. But there's no clear, penalties. If people transgress this, what would happen to them? And there's really no clear, how people who are economically vulnerable will be helped. There are talks about social aids that will be distributed next week, but people are really unclear how it is going to be. And this is also not a nationwide measure, because in order to implement this on a city or a province, the governor, district head, or mayor have to apply to the Minister of Health for a permission to do these measures in their respective areas, right? So Jakarta has now begun its measure on Good Friday. Jakarta is the first one, and Jakarta is the epicenter of the outbreak. And it has just started these measures on Good Friday, which is 4 days ago, right? And then Jakarta satellite towns will start on the 15th of April. So you see that Indonesia is really still in the beginning of a slightly stringent measures to combat the virus. In comparison with other neighboring countries, we are late. I mean, Malaysia has started MCO since 16th of March. Bangkok has been on partial lockdown on the 24th of March, and then 26th of March, there is this emergency situation announced. And in the Philippines, Metro Manila has been on lockdown since, if I'm not mistaken, 16th of March also, and extended to the whole of Luzon. So compared to other big countries in Southeast Asia, Indonesia is 1 month late, basically. But still, we are very hopeful that these measures, no matter how unstringent, would actually be effective. And we also hope that there will be mass testing available very soon, because without mass testing, without testing, then any measure would be a bit, useless. So, like I said, there is also concern on the policy level, like that reliance on security and policy, security and political logic, especially this worry about the civil emergency that would potentially introduce a more repressive, style of mitigating the virus, including limitation of freedom of expression and restriction of the press. And also there is this kind of worry. I think I have to share this. There will be Ramadan month very soon, fasting month. And at the end of fasting month, there will be a holiday called the Idul Fitri. This is equivalent to a Chinese New Year, so where everybody goes back to their villages, to kind of see their family and friends. But with this kind of situation, there have to be stringent, measures on this particular thing, on this particular tradition. If the government does not firmly ban people from going back to their villages, we are going to look at a massive infection rate spiking up at the end of April. Sorry,
we have to wrap up.
Okay, yes. Wrapping up, we are hoping that ASEAN would, come up with how to look at this as a community, because obviously each country has different way of, mitigating or suppressing or combating the virus, and we have to look at this as a community and not only just looking at our own countries. Thank you.
Thank you so much, Dr. Deasy, and I think you will get the chance to discuss further in the Q&A. And based on the trend, I think in a few days, Indonesia will be surpassing Malaysia as the top country in Southeast Asia in terms of, and when what you've said, that it just had started its measures to suppress the infection, that we might have yet to see the worst in the country. Hopefully, we hope that it won't happen though, but based on the trends, it will. Now,
we really hope.
Now, thank you so much, Dr. Deasy. If you have any questions, please hit her on the Q&A box. Now we will move on to another country, which will, I think, in a few minutes surpass Malaysia as a top country with the most number of cases, the Philippines. And we have Dr. Lee Garcia, who is a health law and reform specialist from the Philippines, who will give his thoughts about proper and the right way to mitigate and to respond to the issue of COVID-19. The floor is yours, Dr. Lee. Thank you so much.
Thank you very much, Joel. Thank you very much to SEAsia and Forum Asia for inviting us in this forum. My presentation is entitled Compliance with Right to Health Standards in ASEAN during the COVID-19 pandemic. And for this presentation, I'll present the case study of the Philippines, but I'd also like to discuss some of the aspects of international law in relation to right to health, so that other countries might have some insights on how to apply such standards in their intervention. So next slide, please. So my presentation is divided in 4 parts. First, I'll do a quick revisiting of the health statistics of ASEAN, and then I'll discuss the right to health standards under international law. I'll present the Philippine case study and the recommendations that is compliant with the right to health standard. And finally, we'll look at ASEAN as a community and what are possible opportunities that we could pursue to address COVID-19 now and to address future emerging infectious diseases. Next slide, please. So I think you've seen this slide, but I'd like to put emphasis into the present state of the COVID pandemic in the ASEAN region. So we had the first recorded incident on January 13, and by March 13, you'd note that there's a steep increase in the registered positive COVID patients. And right now, as mentioned by Joel a while ago, Malaysia has the most number of COVID positive cases, followed by the Philippines. We see low incidence in Laos and in Myanmar, but as I discussed later on, this could also be a factor of a limitation in the testing capacity. But as you can see, the general trend in ASEAN member states is that there's a stable, increasing incidence of COVID positive patients. Next slide, please. So this table sort of situates each country in relation to the vulnerability to COVID and also the confirmed COVID-19 cases per 1,000 population. So you'd see that most of the countries here have the letter B qualification. That means these are the countries. So most of the countries, they have more than 100 registered COVID positive cases within a 7-day period monitoring, and they are registering and they're in the acceleration phase of the pandemic, which means that each day we are getting more confirmed cases. And earlier on, only the Philippines registered a negative transmission rate, but there are some questions in relation to the reliability of this data. We have Laos and Myanmar. They are letter A, which means that they're registering less than 100 confirmed cases within the 7-day monitoring period. But some comments on that status is in relation to their capacity to test as well. So as a general rule, we can say that we are just in the beginning, in the acceleration phase of the pandemic. Next slide, please. So as we know, COVID-19 has affected almost all countries all over the world. And I'd just like to show this picture to situate ASEAN in relation to the rest of the world. As I've mentioned a while ago, we're in the B, or in the yellow category, which means that we're steadily increasing and we're yet to reach the peak of the pandemic. Other countries, you can see that they're in the red zone, which means that very steep and very high incidence of COVID cases. And there is a question of how we should respond to COVID-19 as member states and as a regional community of nations. And the recommendation is really to use the right to health framework as the main tool for responding to COVID-19. And I'd like to discuss what that means in terms of standards. Next slide, please. So under international law, we have obligations. The states have obligations to respect, protect, and fulfill the human rights of everyone. And under the right to health standards, I'd like to highlight specific obligations. So under the UDHR, everyone has a right to a standard living adequate for the health of himself and his family. And I'd like to emphasize the next parts, including food, clothing, housing, medical care, and necessary social services. So whenever we contemplate of health interventions, it shouldn't just be within the confines of being seen by a doctor or being able to go to a hospital, but we need to look into the elements of provision of food, clothing, housing, medical care, and also social services. So that's a fundamental point that I'd like to highlight at the beginning of the discussion of the standards. The second provision I'd like to point out is in relation to the ICE-SER, Article 12.1. State parties, they recognize the right to health of everyone, but this is in relation to the highest attainable standard of physical and mental health. So the wording here, at highest attainable, that's a double-edged sword, because some states would say that they don't have the resources to meet the highest standard of physical and mental health because the qualification there, attainable, is placed. But at the same time, you can also argue that the state has an obligation to maximize all resources within its disposal to reach the standard of highest attainable standard of physical and mental health. Next slide, please. The right to health should not be seen disjunct from other freedoms and entitlements. So whenever we talk about right to health, that's also the right to control one's health and body. And that's the right to be free from interference, the right to be free from torture. We've noted and monitored some instances wherein there are some instances wherein an individual is placed in cages, or for violation of quarantine, they're made to stand under the heat of the sun, or some LGBT who were caught beyond the quarantine hours, the curfew hours, they were asked to do dancing. And these are inhuman and cruel treatment that are related to the right to health and the right to be free from interference. Next slide. So the right to health is also a right to a system of health protection. So that means they have the access to health services that will not push them into further poverty. So there should be a system that would allow them to maximize their health, but at the same time would not create a devastating effect to their family and to their economic status. We note that because of the quarantine, there are individuals who could not do work from home arrangements, and the government is in a position to respond to that new need of vulnerable population. And we also note that the highest attainable standard of health is in relation to the socioeconomic conditions of the state. Next slide. An important element of the right to health is the underlying determinants to health. So without an analysis of water supply, sanitation, supply to food, nutrition, housing, healthy environments, and health education and information, then the right to health will not be, the standard for the right to health will not be satisfied. Next slide. So for the next parts, I'd just like to highlight that availability, accessibility, next slide, acceptability and quality. So availability, accessibility, acceptability, and quality, these are elements that we have to assess whenever we look into an intervention. And I'll discuss more thoroughly on this later on. Next slide. So I'd like to present the Philippine case study, and there are some recommendations that I'll introduce in relation to how the Philippines can respond better to the COVID-19 pandemic. And as mentioned by Yuyun a while ago, other countries should look into their specific context to know whether that's applicable to them. But for the Philippine context, the earliest recorded case is on January 30, and this is from a tourist from Wuhan. The local transmission started on March 6, which is about more than a month after. And 2 days after, the president declared a public health emergency. The quarantine was ordered in Metro Manila on March 15. Next slide. But the entire northern Philippine island group, the Luzon group of islands, was placed into community quarantine on March 17. So the exception to the limitation of movement would be on the essential supply. And on March 26, the president was granted additional powers to respond to COVID-19, and the Philippines was declared in a state of national emergency. Next slide. So right now, we have 4,648 positive cases and 297 deaths from COVID. Next slide, please. This slide shows the testing capacity of the Philippines. I'd like to just focus on the first column, the darker blue one. And if you can look at the last two columns, the total tests conducted and the remaining number of test kits. So the testing capacity is very important because, as we all know, most of the interventions that we have are reliant on our ability to determine the part of our population that is COVID positive. And right now we have 86,000 remaining test kits that we can utilize. Next slide, please. It's also important to note the number of beds and ventilators available, because that will determine whether a country will be more aggressive in, say, lockdowns. Because if your bed capacity is already very limited, then more aggressive interventions are needed. So at this point, we have about 65% ICU bed availability still. Next slide, please. So personal protective equipments in different hospitals should also be monitored by states, because that's also would feed into their understanding of whether they need to intervene more aggressively. Next slide. I'd like to discuss the CDC model for the pandemic interval, because this will essentially give insights on what specific intervention we should do. So the first interval is called the investigation interval. So this is the first noted cases of COVID. So the interventions for states here would be treatment, investigation, and monitoring. recognition is where we note person-to-person transmission. And in this case, more investment in drugs, vaccines, monitoring should be performed by the state. And then we reach the initiation or acceleration phase. So depending on the context of the country, of the member state, then aggressiveness of non-pharmaceutical intervention will be dependent on this. So if they are in the acceleration phase or even in the initiation phase, it's recommended to do social distancing, hand washing, cough etiquette, and even quarantine in certain localities. Even if you reach the deceleration phase, those non-pharmaceutical interventions must still be in place. And the preparation is an important interval because we note that there can be another peak after the first wave. So based on the mass testing that we have, we'll know which state your country is in, and we know what specific intervention we need to do. Next slide. This is quite a busy slide, but I'll leave it here for future, I'll share the slides later on, but I'd like you to focus on the middle part. You have the flow of susceptible, exposed, infected, and recovered. So our goal here is to cut the transmission from susceptible to exposed. So you'd see the interventions above it. So those are the behavioral risk reduction interventions. Those exposed, you'd see at the bottom line, we have the isolation interventions. And for those infected, you'd see the interventions at the top in relation to hospital interventions. So I'm just going to leave this for the participants to study later on, but this will show where your country is at so that you'd know what intervention to do. Next slide.
Yeah, we have 1 more minute, Dr. Lee.
Okay. So to summarize, here are the recommendations for the states depending on where they are at. So the crucial health interventions would be mass testing, contact tracing, isolation centers. If there's a singular intervention that would be very important to cut the vulnerable population to being exposed and to being infected, that would be isolation centers and calibrated quarantine measures depending on the pandemic interval where they are at. And I'd like to highlight some interventions that we could do during quarantine. It's important that we have social and economic reliefs, decongest prisons, as was mentioned a while ago, do telemedicine and research on vaccines and drugs as well. Next slide. I'd just like to highlight that during quarantine measures, the human rights are still applicable. And we've already noted some degrading treatment and punishment, which should be monitored by ASEAN as a region and should be responded to. Freedom from discrimination has been also apparent, especially for those who are frontliners. Next slide, please. And for the ASEAN, I'll leave the next parts of the slide, but for the Health Cluster 2 priority strategy, there's a focus on sustainable development goals. As we've noted, the intervention should not just be from a health lens, but also from a socio-economic lens. And let's go to the last slide. Next slide. Before that, sorry. Here. So the responses should be context specific. So we need to test so that we know which state we are at in the pandemic interval. So we know what to do as an intervention. And we need to be mindful of the right to health standards. And ASEAN needs to be more proactive as a community. So in the previous slides, you'd see some recommendations on how we can respond to as a community. But as mentioned by the previous speakers, while there are some activities, they are not as felt by the community as a whole. So next slide, please. Thank you very much. So I'd just like to make a special mention to our frontliners from the Philippine General Hospitals and from our civil society partners as well. Thank you, Joel.
Thank you so much, Dr. Lee. And what you've mentioned, I think from a right to health perspective, that we need to, the approach has to be more holistic, and we need to be mindful of the impacts, socio-economic and political impacts of COVID-19, even while the waves of infections are happening. Thank you so much. We look forward to the discussion later, the Q&A. I think there are some questions for you in the Q&A box, which you can also respond while the presentation is going. Thank you so much, Dr. Lee. All right, now we move to Dr. Sriprapha Petcharamesree, and she will give us, perhaps she may give us a wrap up of the presentations as well as her analysis of ASEAN, of the ASEAN response and position towards the COVID-19 crisis. Dr. Sriprapha, the floor is yours.
Thank you so much, Joel. Good afternoon. Thanks to JEPSI and Forum Asia for jointly organizing this particular seminar, which is very timely, and I think it's very important. You don't see me on the screen because I don't have camera, so I hope you can still hear me. Actually, what I'm going to do is, Joel just mentioned that I will first, not summarizing, but providing some observations from my part on what I heard from the previous 4 speakers. The second part is actually what ASEAN has done as a group. Yuyun has shown you in her slide some good picture of the ASEAN policy commitment and what ASEAN has done. But I think what we have seen is not really, in my opinion, human rights based. And then the third part, which is the conclusion, is actually how I see ASEAN from to respond, especially from human rights perspective, or rather what I don't see. I have actually listening to 4 speakers. I came up with at least 4 or 5 observations. One is you might have noticed that first of all, if you look at the statistic provided by Yuyun and by Dr. Lee, you can see a kind of mix of picture, because some countries have rather low caseload, while some other are seeing the number of caseloads rising very quickly. I have here some observations that countries like Myanmar, Cambodia, and Laos seem to have very low caseload, very low cases of infected patients. While looking at the geographical proximity, Laos and Myanmar are sharing very long borders with China. So I'm having some doubts with the statistic. And I guess what I heard from Ted was it says something there. So in the same time, we also see the difference in the way that different countries have been responding. But although with different ways of responding, one thing that I also see is what I call state-centric and repressive responses. When I say state-centric and responsive responses, because actually responses have been based on repressive measures. Some countries are now using emergency law, for example. Of course, with curfew, quarantine, these are what I call repressive measure. In Thailand, one of the minister, actually the Minister of Education, just said, I think one day after or before the declaration of the state of emergency law in Thailand, it said quarantine, no human rights, and no quarantine, no human left. That was actually the slogan used by a Thai minister over a week ago. So actually repressive measures in order to cope with pandemic COVID-19. The third one that I also see in many countries is actually about securitization of pandemic. When I talk about securitization, it's not only on the use of security measures, emergency law, but also making use of armed forces and police officers in order to impose, of course, quarantine. So you see, for example, in Thailand, every day you got thousands of cases in which people who actually broke quarantine, not quarantine, curfew, arrested by police officers. And actually in Thailand, the head of the emergency group is led by a general. So that what I call securitization of pandemic in many cases. The next one that I also see is actually response in ASEAN is I already mentioned about state-centric, but also a state-based, not really community-based. So we don't see much of at least what I have been following up in ASEAN member states because it's state-centric. So it's not community-based, and there is complete lack of what I call social safety net, especially for the most vulnerable groups. Something that Yuyun has mentioned at the very beginning. The last one that I just want to mention is actually about there is no systematic monitoring of human rights violations or human rights impacts of the member states of ASEAN because their focus is really about controlling pandemic and making sure and to borrow what Deasy has used is actually flattering the statistic of caseload of infected in different countries. So really about control measures rather than human rights-based measure. I am happy to hear that Yuyun is monitoring human rights because of COVID-19 in Indonesia. Then my last observation here is that in ASEAN, initiatives is usually based at national level. So it's really state-based, not regional-based. So you don't see a regional monitoring when it comes to human rights here. I was expecting to hear something about initiatives of AICHR as a group, but what I just heard is initiative from Indonesia, and because it also depends on different representatives. So those are some of my observations from what I heard. The second part, and I found this very interesting. Actually, the working group for an ASEAN human rights mechanism that I'm co-chairing together with Dato Param Kumaraswamy. The working group is now preparing, a paper. So I got the draft prepared by the secretariat. Interestingly, they have analyzed in a rather systematic way the human rights violations because of, the advent of COVID-19. And of course, we heard from some speakers already that we see human rights violations already. Labor rights, for example, I think I heard from Ted from Myanmar talking about the return of Myanmar workers to Myanmar. But you also witness, the workers, Thai workers that are trying to get back to return to Thailand, trying to cross the borders. Some point border was closed. So worker rights, and this is actually more serious, especially with migrant workers, as I mentioned. The second one, which was analyzed by the working group, is actually the surveillance, the measure used by different states, actually all states in ASEAN, actually clamp down on freedom of expression, freedom of speech. Many countries are now using the law, not only emergency law, but also, law on fake news. So you got, countries like Myanmar, Singapore, Thailand, the Philippines, they are using the law on fake news. So actually it has very serious impact on freedom of expression and speech, which is actually linked to disclosure of information as well. Because some countries, in some countries, some NGOs were already arrested because they have released information or data which is actually different from what we heard from that particular government. Another thing that Deasy has mentioned is in some countries, lack of transparency. So because of the pretext that they didn't want to start the panic among the population. But I think disclosure of information is extremely important, not only for the protection of people from the pandemic, but also as a response measures. Uh, uh, Another one which is also important is actually lack of support and discrimination against healthcare workers, and also against, I think we heard earlier, against those infected. Um, 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 Inadequacy of the healthcare systems in some countries. Well, in Thailand, we are quite lucky in the sense that, the health system in Thailand is quite good when compared with some other ASEAN member states. Still, uh, the medical doctors are worrying that, if the number of infected is rising rapidly, then it would be very difficult for existing healthcare to cope with. Another thing that I think we do not discuss that much is actually about, food security. That some people, especially the most vulnerable groups, will be facing, or they are already facing. Some of them are actually relying on only donation or food provision by different organizations, faith-based organizations, and NGOs. We also see actually disproportionate, impact on vulnerable populations, on women and girls. The fact that many people, or most of people, are quarantined at home. There are some reports that are talking about the rising level of domestic violence, for example. I think we also, many countries, in some countries, we also tend to forget those, in detention and in prisons, because if one case happens, it will be infecting many other people. Then the last one that we also see, and I try to systematize here based on, as I mentioned, the paper that the working group is preparing is actually about stigmatization, xenophobia, and racism, and we see more and more, in our region. So these are something that I like to share when it comes to human rights issues relating to the advent of COVID-19. My next point is actually what ASEAN has done. Yuyun has talked in length about that already, but I just like to mention two things here in addition. One, actually just this morning, because there is, I don't know, a virtual meeting of AMM, the meeting of foreign ministers of ASEAN, and they, they have endorsed something which was proposed a few days earlier, and that is the ASEAN COVID-19 Response Fund. This ASEAN COVID-19 Response Fund, of course we see information, but actually we don't really know what would be the way of using it, who can be using it, but at least this is the initiative agreed upon this morning as in COVID-19 Response Fund. So I'm not quite sure, as I said, how it will be used. We will need further information from ASEAN. The ASEAN ministers of foreign affairs also agreed on, I think Yuyun has already mentioned about information sharing, strategies and ways to ease the impacts of the global health issues on people and economy. Actually, this looks quite positive. But again, because there is no concrete information about this, but I think, with this kind of regional policy, maybe academics and NGOs could be, capitalized on it. It says on people and economy. As of now, we see more economy than people. So that is a regional initiative. There's also a bilateral initiative, which I found, quite interesting, and that is the initiative between Malaysia and Singapore. These two countries formally form what they call a joint working group to prevent the spread of virus by focusing on sharing information.
Ajahn, you have 1 more minute. Sorry.
Sorry?
You have 1 more minute.
Okay. Adopt, similar border screening procedures and expand cooperation. Again, I think this bilateral approach is always predominant in the case of ASEAN. So I'm concluding now by actually putting a few proposals, especially for human rights bodies. By human rights bodies, I'm looking at AICHR and ACWC. So I am actually proposing a few things. First of all, rather than individual monitoring that Indonesian representative is doing, I would urge, AICHR, maybe through initiative of Yuyun, to actually develop monitoring system for AICHR, especially when it comes to monitoring human rights impact of pandemic. The second one that I would be encouraging AICHR and ACWC is actually development of the common position on human rights. I would want to see at least I think someone sent some message because I think in AICHR terms of reference talk about development of a common position on human rights. Actually, this is a time for AICHR to demonstrate that AICHR could develop a common position on human rights when it comes to COVID-19. So these are a few things that I'd like to call upon AICHR to look at it. Thank you.
Thank you, Dr. Sriprapha. And I think there's still so much to expect from AICHR and from ASEAN as a whole. And I think what you've said is that people are the minister are meeting at the moment, and I would like to just to stress that it's something that we haven't felt yet in the region, and we hope to feel that impact anytime soon because people at the moment are being infected and dying. Thank you so much. For now, we will give a 2-minute break. It's supposed to be 5 minutes. 2-minute break for people to just reflect and for our presenters to take a break to breathe. And then we will commence the question and answer. We've got a number of questions being posted at the moment. So the 2 minutes starts now. But while for the 2 minutes, so we can give the time for them to relax. May I ask the admin to please put up the introductory PowerPoint, please. I will just do some PR on what ShapeSea is doing at the moment. Aside from organizing a webinar, ShapeSea is also, we have opened our website for opinion pieces on the state of human rights and peace in the time of COVID-19. And at the moment, we have received around 45 essays, and ShapeSea would be glad to receive any of yours submissions. We have yet to receive submissions from Brunei and from Vietnam. I'm quite surprised that we haven't gotten any from Vietnam at the moment. But we will very much welcome any of your submissions. We will also provide proofreading and editing services so that, and this is what some of my colleagues are calling an academic block, no? Meaning that, that the response of academics would be swift, and this is what we're trying to do, and this is an ongoing project. So while this is happening, and even after we get some resolve of this conflict, of this crisis, we will still be receiving essays, and we hope that in the future we can that we would be able to compile all the essays and turn it into a publication, hopefully soon. So we have posted and I will be sharing with you the link to the published essays, the public opinion pieces on the SEAsia website. So please do not hesitate to send your submissions. At the same time, we would also love to receive submissions on peace and COVID-19, peace and conflict and COVID-19, and we hope to receive them from the group. And please do share the news to your colleagues and friends. All right, so 2 minutes, I think 2 minutes are done. So we will now open the floor for questions. We have one question here, which I think, one question here that I think would be applicable to all, and I would love to hear the response from all our speakers. Mayang Azurin asked about insights on to what extent to which regional politics, and I believe this is about ASEAN, impinging on national and collective response on ASEAN countries. May I get some of your thoughts about this, please? Again, the question is, she wants to get insights on to what extent to which regional politics is impinging on national and collective response in ASEAN countries. Who would like to start? Yuyun?
I can start, Joel.
Yes, Ajahn, please.
Okay. I think actually I was looking at this particular question with interest earlier, and I look at it from maybe 2 perspectives. One is actually about political trend in this region, and political trend in this region is not very democratic, as we all know. Even country like Malaysia, that we had so much hope until early this year, when there was a change of the not the government, but at least the prime minister. So I think the current trend, regional political trend in ASEAN, has something to do with the way ASEAN and different countries are responding to COVID-19 as well. So that is my my very quick look at it. The second one is actually about the national political system. As I mentioned earlier in my talk, that we do not hear that much from countries like Myanmar, or or Laopedia. We heard from time to time Cambodia and the Philippines, and you see quite well that when you heard the Philippine president said that if someone do not respond to the measures applied or imposed by the government, then police officer, armed forces are actually allowed to shoot. That actually shows the political space, a political situation in the country. This is exactly the same as in Cambodia, when actually not Cambodia but some countries with authoritarian leaning already, they are now better equipped with repressive law. Especially, I mentioned earlier the use of emergency law. So these are some of my thoughts.
Thank you, Dr. Sriprapha. Does any of the speakers want to answer?
What is the question? Sorry, I was out.
So the question is, sorry, your insight on to what extent does regional politics impinge on national and collective response on ASEAN countries?
I'm not sure, but I think from what I've observed, countries are reluctant to be honest on what has been the problem in the country, because they don't want to be seen as bad or not responding to this issue, you know. So this honest or lack of honesty on sharing of information really make ASEAN as a regional organization difficult to move forward. I've been hearing this from either journalists, from many staff. They said that is not what media reported, and some countries, they only report on something good about their countries and not necessarily a problem or gaps. So it is difficult for other countries to really or to agree on something. So even though sharing of information has been agreed from one meeting to another, but the content of the sharing of information is still perhaps unreliable at some point.
Okay, thank you, Mbak. Okay, may I call on Ruthra, who's raising his or her hand to ask the question? Can our admin please unmute Ruthra? Thank you. Hello, Ruthra. Ruthra? Can we hear Ruthra?
We can't hear Ruthra, but I've already allowed him or her to speak.
Ruthra? Okay, we wait for Ruthra. But Ruthra, don't worry, we will give you that space. Please, if you can unmute yourself, or then we can hear your question. There's also a question. Okay, we move to another question. Huh? I guess we also got one question on the issue of intimidation of health workers and journalists, COVID-19. From a human rights perspective, what are the actions to be conducted to ensure that especially authoritarian governments don't use COVID-19 in the aftermath as additional mean to limit civil space? So we're talking about authoritarian government taking advantage of this situation to shrink or to purge human rights and freedoms in their respective countries. How do we ensure that? Does anyone want to answer?
Our answer.
Yes.
This is actually what we are worrying, because like in Myanmar, as you all know that the Aung San Suu Kyi's led government and also the military, so they are actually in the power struggle. So what we are worrying is that if the government cannot control the situation, if the outbreak happen here, then we are worried about the military coup again, like in Thailand, that the curfews that if the military coming back here again, so we are really worrying that the civil society space will be shrinking, because even right now, we got a internet shutdown in Rakhine State, and then the the information flow is very bad. We don't know anything about all those military atrocities in those Rakhine, Chin, and Shan State, those 3 areas, and also about the oppression of the media. That a few media were sued by the military for doing interviewing the Arakan Army AA, because the government just recently announced that Arakan Army as a terrorist group. So when those media contacted them, so all the media chief, they were arrested, but they were released luckily recently. But this is how they can threaten to the civil societies and to the activists and also to the media. So they can scapegoat the COVID-19 as a tool to control all the civil society and also to the media. This is what we are worrying. But we have apparently our activists and civil society groups, we are very weak now. So we don't. That COVID-19 is actually out of our control. We cannot do much. The most we can do is that we can raise awareness to the people about the situation, and we can raise our concern to the government. But we need the government collaboration, to fight together. But if the government does not open, or does not welcome us, then there is no point for us to, work for it. But that is our biggest concern is about the military coup. If it happens, then our democratization will also be aggression.
Okay, thank you. Dr. Lee, you have something to respond?
Yeah, so in relation to human rights abuses and using COVID as an excuse, I think the first thing that civil society and human rights advocates should do is to ensure that at this time we have an efficient monitoring and documentation process. And we might not be able to fully pursue a legal remedy at this point, but we can do transitional justice later on, that after the COVID pandemic has been responded to and we've fully documented all the violations, then government accountability can still be pursued after. During the time of the crisis, it's very understandable that our remedies are very limited. But in some instances, a very vocal civil society has been able to prevent governments from furthering human rights abuses. Like in the context of the Philippines, for example, there were some reports on some public criticism against the government being subject to investigation by the National Bureau of Investigation, and there's a huge backlash in social media, and from that, we note that even the NBI stepped back in pursuing actual cases against individuals who are merely exercising their freedom of expression. And through also a visible social media participation, we're able to mobilize some of our networks, some of our connections from human rights advocacy groups. And so we can pitch in and share some of our support to other individuals who need their assistance. So I think it's a very valid concern that governments might abuse COVID as an excuse to do human rights violation. The important thing at this point is to be very vigilant, to resist as much as we can, and to monitor and document for transitional justice later on.
Thank you so much. All right, we have
Joel,
yes,
could I add just
yes,
one
please.
word?
Yes.
I just want to look at the flip side of of this particular question, because I think as of now the priority of media is actually to covering COVID. So the fact that COVID is covered by all media, it means that other human rights violations are more or less forgotten. I just like to remind this.
All right. Valid point, Ajahn. Okay, I will just, if you can just allow me to extend this to a few more, because we have 3 questions, and perhaps I will ask all these questions together, and then I will give each of our speaker to give their final word. There's a question on how can other relevant sectoral bodies participate in ASEAN's COVID response in the sphere of these areas of cooperation. We are very much aware that ASEAN is working in silo, and it has always been. How can they work in collaboration for response? There's also a question on the need to consolidate efforts and what civil society in the region can do to address these issues also, and how perhaps this can actually be a good starting point for ASEAN and the regional civil society to work together in responding to the COVID-19 crisis and the aftermath. Lastly, the question will be on how do you involve national human rights bodies, national human rights institutions in this bout against COVID-19. May I start with Yuyun to give a response and maybe imparting words, please? Thank you.
Okay, thank you very much. I think I have answered some of the questions in the Q&A and chat box, but these are some questions that I haven't answered. First, I would like to start with the NHRI. I'm not sure with other countries, but in Indonesia, the National Human Rights Commission, Komnas HAM, has been very active in directing the policies on how government can address the COVID-19. They at some point, presidents often rely on the opinion of the Komnas HAM to take some of the measures or imposing measures on restriction, whether or not it is going to be violating human rights, or it is allowed or in human rights or not. So there has been a dialogue between central government and NHRI. So I think in the context of Indonesia, Komnas HAM has been very, very active. And in our monitoring, we are also looking at what other national human rights institutions in Southeast Asia had been doing. So we would be very happy to document this kind of efforts. I think that's whether or not AICHR will come up with a declaration on COVID, I'm not sure. That's a huge task, but why not? We can always table it and see how others will respond. Hello?
Yes.
Yeah, okay. So I thought, because it's a freeze in my computer. And how to bring ASEAN sectoral bodies to join COVID-19. There is something that I hope the ASEAN summit tomorrow will come out, is to give instruction to ASEAN other sectoral bodies to take action on this, because this is government. Government need to get instruction from the leader, the head of the state, to able to move forward. And I think it is very important to think about the aftermath, because we already see that now the number of poor people will increase. The number of people without work will also increase. So we need to address this through different kind of measures. I'm observing some of the organization come up with this economic small and medium business using the online services. So that's something that create perhaps the pillow for the crisis later on. I also observed that a lot of ad hoc, caritative, a quick response to address the the need of eating food every day, which only happen many in cities. It would be good to also see it at the villages level. I just worried with the way I work as AICHR representative of Indonesia and the way AICHR work, because we seem to be not going anywhere from the normal. I think COVID-19 introduced us the new normal, which something that we need to find out how to make it effective to our future life after COVID. And I'm actually also wondering how this COVID-19 will change the way AICHR work or ASEAN work in general, which unless it is about moving the meeting into online, from physical meeting to online meeting, I did not see the change of the way ASEAN or AICHR work, and which actually worry me so much. Perhaps this something need to be explored further. I'm ready to change the way AICHR work so far, which sometimes is ineffective. And I'm very open to have more inputs on how AICHR, both Indonesia or AICHR as a regional organization, can work further using COVID-19 crisis and opportunity to change.
Okay, Ted, do you have a short response to any of the questions and some parting words, please?
Yeah, and my parting word is about the education. Like, we should also think, because we don't know how long this pandemic will be, because right now our schools are closing. So we don't know if they can reopen it or not. So we should also think about the possible online education to the children, or any other alternative education system, across the ASEAN region or whatever. If some of the developed countries like Singapore or whatever, if they can help, or with the technology, that would be so great. Like otherwise, I'm worried if they delay 1 year for the schooling for the children, it will also be affecting to the society. So this is maybe something that we can think as a ASEAN wise, for the education for the children. That's all.
Thank you. Deasy, Dr. Deasy.
Okay. Hi. Yeah. About the questions that have something to do with ASEAN, I think Yuyun would be the person who, and she already answered the questions. I just want to add something about the potential transgression of human rights in this very difficult period. Sometimes this transgression also has nothing to do with COVID, but for example, we have to be aware of the possibility that there are governments that would use this kind of this situation, this difficult period, to issue laws that are unpopular. So because people's bandwidth are on, the focus are on the virus situation, that they forget that there are other things that might be might be in risk of human rights transgression. I can say something about there is a plan in Indonesia. There is a plan to issue the omnibus law on labor, and this law has a lot of very concerning articles, and that might pose challenges to our laborers. So if this law is issued, then it will, even add to the burdens that our laborers are already facing now because of this difficult period. So we have to be, very vigilant on, observing all the other situations outside of COVID that might actually be, in danger to be, for a human rights transgression. And also another thing, there's, I didn't say this, but in Indonesia, there is also, recently the police has also issued a regulation that would allow them to apprehend people who are considered having insulted the government. So a lot of law experts have been saying that this is actually irrelevant, you know, to the situation at hand, that focus has to be on how to, you know, combat the virus instead of, you know, taking care of who actually have insulted who. So, you know, all these things we have to be paying attention to, and hopefully that ASEAN can, you know, act as a community and keep on observing this in the region.
Thank you so much. Thank you so much. Dr. Lee, do you have some parting words?
Thanks, Joel. I think most of the questions on ASEAN is really a question of relevance, like how much political will does ASEAN have to be relevant at this time? Most of the interventions that we see are very localized based on member states. And while there are some initiatives from ASEAN as a community of nations, the impact is either ideational, like these are the things that we want to do, but in terms of implementing them, that is yet to be felt by the community in general. And I think COVID is a great opportunity to finally realize that dream of ASEAN to integrate and to really act as a community. We've been saying for the long time that there should be more cross-border support for health, human resources, for supplies, for medicines and agriculture. And these things, I think, were important challenges now that we have COVID. And it might be a good starting point to revisit the post-2015 Health Development Agenda, because reading through that agenda, it seems very clear in terms of the recommendation for research collaboration, for disease surveillance, for support in terms of developing vaccines and drugs, and for sharing information. Very good points, but I think the challenge really is to translating that into actual collective response from the ASEAN. From the CSO side, from the civil society, I think at this point, what we can do is to challenge our governments more and to mobilize our networks. There will be a lot of limitations for the government as we've seen in the past. And the best we can do is to mobilize our network for now and to try to resist any form of abuses that we can see from our governments.
Thank you so much, Dr. Lee. Those are very important words and recommendations for moving forward. Dr. Sriprapha?
Thank you, Joel. My last 3 points. One is about the roles of national human rights institutions. Definitely, you know, wherever a human rights institution exists, they should be doing something. Unfortunately, not all human rights institutions are functioning. Like the one in Thailand is not well functioning as of now. But I think it's also their role to look at the human rights impact of COVID-19 in their own, you know, country. The second one, I would want, you know, to see ASEAN bodies to be more proactive rather than reactive, because, you know, countries not only at national level, but I think regional level like ASEAN as well, they are more reactive. I mean, responding to the situation rather than looking at the way in which they could proactively responding together, especially with participation of the people as well. And this is related to state-centric way of response that I mentioned earlier. My last point, I agree with, I'm not quite sure whether it was Dr. Lee or someone else. I see COVID-19, I think COVID-19 could serve as a soft entry point, you know, for ASEAN bodies, in this case, the AICHR and ACWC, to work together. But I think the approach suggested by Dr. Lee, which is about using right to health, but also I think right to education. But it's not just like, you know, okay, we are doing thematic study with nothing come out of it. But as I said, you know, this could be were used as a sub-entry point, for human rights bodies in ASEAN to work together. Thank you.
Thank you, Dr. Sriprapha, and I apologize again for the extended time. There's a wealth of issues and themes that we have yet to discuss in 2 hours is not enough, apparently. As I mentioned earlier at the start of this of this webinar, it is a series of this webinar is part of a series of talks, of discussions on the status of human rights in the time of COVID-19 pandemic in Southeast Asia. And next week, the theme will be on what is ASEAN in COVID-19 response through the feminist assessment on the ASEAN response to the COVID-19 pandemic. And it is organized, it will be on the 20th of April, 2020, from 2 p.m. to 4 p.m. I believe this will be extended, I guess, because of the need for time. And the organizers will be Forum Asia, APWLD, ARROW, and the ASEAN Soji Caucus. And I think this will be a timely discussion as well, looking at employing the feminist lens in scrutinizing and in giving their assessment on the ASEAN response and position. Hopefully ASEAN would be giving more, that we would be hearing more from ASEAN in the coming days, and definitely that would be the main theme and the topic of next week's webinar. As a parting note, I believe, and I think I would like to echo what our speaker said, that COVID-19 is definitely a litmus test for ASEAN in terms of its relevance, in terms of its importance in the lives of its peoples. And it also challenges its commitment to enabling a people-centered community, and how it can bring about such case in these very trying times. And we hope that ASEAN does something about this, because we would come out as a wounded region, definitely, and hopefully the new normal will compel ASEAN to be more people-centric and eventually be people-driven. So that ends our webinar for today, and we thank you again for your participation, and we look forward to the next series of webinars. Thank you so much. Maraming salamat. Kopun kap.
Thank you. Good ka.
Thank you.
Thank you for all the panelists, moderator, and the participants. We will send the PowerPoint presentations to all participants. Thank you.
Thank you.